Welcome to this video on general health and population indicators based on Chapter 6 of Introduction to Epidemiology by Ray M. Merrill. In this lesson, we'll explore how public health uses health indicators like mortality rates, life expectancy, and years of potential life lost to assess population health. These indicators provide measurable insights into a community's well-being and help evaluate progress toward national and global health goals. What are health indicators? Health indicators are variables used to describe the health status of a population. They allow us to track trends over time, compare populations, evaluate intervention effectiveness. Health indicators are usually expressed as rates, ratios, or percentages and often reflect mortality, morbidity, reproductive health, life expectancy, quality of life. These indicators are essential for guiding public health programs and policymaking. Life expectancy. The first major health indicator is life expectancy. Life expectancy tells us the average number of years a person is expected to live based on their current age and sex, assuming current mortality conditions remain stable. Life expectancy at birth is a key measure of population health. It reflects access to medical care, nutrition, sanitation, disease control. In the United States, life expectancy varies widely by race, gender, and even neighborhood, highlighting significant health disparities. Birth and fertility indicators. The second set of indicators relates to birth and fertility. Important measures include birth rate, the number of live births per 1,000 population per year. Fertility rate, the number of live births per 1,000 women of reproductive age. These help us understand population growth, reproductive health needs, demographic shifts over time. High fertility may indicate a younger population with future workforce potential, while low fertility can signal an aging population and higher dependency. Mortality rates. The third group of indicators includes mortality rates. Several types exist. First is the crude death rate, which measures the total number of deaths in a population per 1,000 individuals. Second is cause-specific mortality, which looks at deaths due to a specific condition like cancer or heart disease. Third is age-specific mortality, which examines deaths in specific age groups such as infant or elderly populations. Two particularly important indicators are infant mortality rate, deaths of infants under 1 year per 1,000 live births. Maternal mortality rate, deaths related to pregnancy or childbirth per 100,000 live births. These reflect the effectiveness of prenatal and perinatal care systems. Proportional mortality and death to case ratios. The fourth indicator is the proportional mortality ratio or PMR. This shows the percentage of all deaths due to a specific cause. It helps us understand what diseases are contributing most to overall mortality. Next is the death to case ratio, which compares the number of deaths to the number of diagnosed cases of a disease during the same time period. This ratio reflects severity, pathogenicity, or health system capacity to manage a disease. Case fatality rate. The fifth indicator is the case fatality rate or CFR. This represents the proportion of people with a specific disease who die from that disease, often expressed as a percentage. Example, if 100 people are diagnosed with a condition and 15 die, the case fatality rate is 15%. This measure is used in acute outbreaks and helps gauge the lethality of a condition. Years of potential life lost or YPLL. The sixth and critical indicator is years of potential lost or YPLL. YPLL quantifies premature mortality. It is calculated by subtracting the age at death from a predetermined reference age, typically 65 or 75. For example, if someone dies at 40 and the standard is 65, that death contributes 25 to YPLL. YPL emphasizes conditions that cause early death, like injury, suicide, or overdose, and is used to prioritize prevention strategies. IPLL can also be age adjusted to fairly compare across populations. Why health indicators matter. So why are these indicators important? They allow us to monitor national health trends, identify emerging issues, evaluate programs like Healthy People 2030, allocate funding to the right areas, compare across regions, income levels, and demographics. Without health indicators, public health would lack direction, accountability, and measurable progress. Let's recap the key indicators. Life expectancy tells us how long people are likely to live. Birth and fertility rates describe population growth. Mortality rates reflect the burden of disease. Proportional mortality and death to case ratios show which conditions are deadliest. Case fatality rates measure disease severity. IPLL highlights premature deaths and helps target prevention. These measures give us a powerful toolkit to monitor, improve, and protect the health of populations. Thanks for watching. Be sure to subscribe and join us in Chapter 7, where we explore analytic epidemiology, study designs, and statistical methods.